Assalamu alaikum warahmatullahi wabarakatuh. So after a very excellent session by शोएब सर, जहाँ उन्होंने हमें किडनी डिजीज़ के बारे में काफ़ी कुछ डिटेल्स में बताया है, प्रिवेंशन एस्पेक्ट्स एक्सेट्रा. So my topic of presentation is challenges in lifestyle diseases. तो आप सबको पता है कि what are the various lifestyle diseases and even many doctors are suffering from majority of the lifestyle diseases. It is basically on your lifestyle, what you are doing, it depends on that, and you are getting these various diseases. And lifestyle diseases nowadays, it is not seeing any age. Even young patients are coming up with heart problems, getting sudden MIs, blood pressure, hypertension. You are seeing cases which are just in 20 years, 20, 25 year olds are suffering from hypertension. Diabetes, yes, many people are suffering. Why this epidemic has occurred? Why this problem is occurring? All of this is because of lifestyle changes. तो क्या है lifestyle changes? What are the various aspects of lifestyle changes? Obesity, पहला वाला. So obesity, as you are seeing, there is an epidemic of obesity, especially childhood. बच्चा खा रहा नहीं. हर पेरेंट को यही रहता है पीडियाट्रिशियन के पास जब वो आते हैं, बच्चा कुछ नहीं खा रहा, बट द वेट ऑफ द चाइल्ड इज एब्सोल्युटली नॉर्मल. दे टेंड टू ओवरफीड द चिल्ड्रन एंड वंस दिस ट्रेंड स्टार्ट्स, बचपने में जब बच्चे को ज़्यादा खिलाना स्टार्ट करते हैं, इट विल कैरी ऑन. आपके नज़रों में आपका बच्चा हेल्दी है, बट जब उसका BMI चेक करेंगे, जब उसको प्रॉपर इवेल्युएशन कराएंगे, तो दैट इज ओबेसिटी. एंड दीज चिल्ड्रन टेंड टू develop hypertension, diabetes quickly, more than the other children. High cholesterol, this is all depending on the diet. आप थोड़े साल पहले तक नॉर्मल डाइट वाज जस्ट मे बी चपातीस, राइस. अभी एवरीथिंग जंक फूड इज इजीली अवेलेबल. स्विगी, जोमेटो, आप जस्ट ऑर्डर कर दीजिए, फ़ोन पे बैठे घर पे 5 मिनट में आ जाएगा. Burger, pizza, whatever you want, French fries. Nowadays, children, they don't eat normal food. They don't eat rice. They don't eat chapatis. They just want fast food. And parents give with it. Parents supply that. So that is the problem. So because of that, they go into all these lifestyle disorders. Diabetes, heart disease, all these are present and they go hand in hand. First, orchid problem in our society. Why? Because the challenges what the doctor faces is basically due to patients. आप एक चीज़ अगर बोल रहे हैं, आपके सामने एक पेशेंट आया फर्स्ट टाइम, आपको बीपी शुगर है? बिल्कुल नहीं. आपने कभी चेक करवाया? नहीं. So that is what, first when you check them, they will come to know that they have hypertension or diabetes or whatever disease, but people don't get tested. And one more very common problem in Hyderabad what we face is, they come to the doctor, you write down series of investigations and give it to them. भाई आप CBP करा लो, रैंडम ब्लड शुगर कराओ, ये 8-10 investigations लिख के दिए. So when the reports come and all the reports are normal, no patient will be happy. He will be like 3,000 बर्बाद करें, 4,000 के टेस्ट बर्बाद करें. अगर उसको कुछ बीमारी निकली तो पैसा वसूल हो गया. कोई डिजीज निकला, अगर उसको कोई डिजीज नहीं, सब अल्हम्दुलिल्लाह नॉर्मल है, उन्हें बस डॉक्टर के ऊपर ही पुकारेंगे, क्यों लिख के दिए, खाली पी के मेरे पैसे बर्बाद करें. दैट इज व्हाट इज द मेंटालिटी ऑफ द पीपल एंड दैट इज व्हाट इज causing this lifestyle disorders. Okay? And non-communicable diseases or lifestyle disorders are the commonest cause of death in the world. Previously, आप एक 25 साल पहले या 50 साल पहले की बात अगर ले लेंगे, तो the most common causes of death were all communicable diseases. Tuberculosis was there, pneumonia was there, but now 70% of all diseases, deaths in the world are caused by non-communicable diseases. Top is cardiovascular diseases, followed by cancers, which are increasing very much. And then you have respiratory diseases, diabetes, and stroke. So all these are common number of diseases, and as Sir told, kidney disease is the next one, which will be added to this maybe in a few years, which will cause a number of diseases, a number of deaths across the world. So what are the contributing factors? Just I was telling you, key first and foremost is unhealthy lifestyle, unhealthy diet. Children are given all sort of junk food and that habit inculcates. When you are seeing any hotel, all the hotels are full nowadays. कोई भी टाइम जाए आप रात में 1 बजे भी जाएंगे आप, it is full, and people are consuming whatever is served to them in those places. No one sees. आप आपके घर में if you are eating anything, you will definitely observe the hygiene. You will observe how it is cooked. Is it neatly cooked or not? But hotel में whatever they serve you, whichever oil they are using, whichever fat they are using, whatever is served, बहुत अच्छी है भाई. शाबाश की बिरयानी बहुत ज़बरदस्त है, and you will consume them. So you will not bother about how it is impacting your health, how it is causing the changes. Nowadays, even small children are suffering from acidity. Even children age of 2 years, 3 years, doctors are prescribing Lansol tablets. Why? Because they are having acidity. वो एज में acidity होना चाहिए नहीं. Why? Because of all this unhealthy lifestyle and lack of physical activity. One more very important aspect is lack of physical activity. पहले टीवी के सामने बैठ जाते थे घंटों. They used to sit in front of the TV. Now just take your phone and sit on a sofa or a chair, continuously playing games or whatever is the way. So phone and internet and television, all these are impacting the physical activity of children. Then apart from that, cigarette smoking and alcohol. Cigarette smoking, even though alcohol is haram, still many people come to us with alcohol withdrawal. They take regularly, they take alcohol. So that is the root cause of many liver diseases. So taking, smoking, alcohol, all these are causes of this, and you will not see the effect immediately. 10 साल, 20 साल, alcohol, smoking, all this, then they finally land up to you with complications. They don't come to you with early stages, they come in the final stages. So this is a systematic review which was conducted, and it has shown that lifestyle modifications alone will result in decrease in non-communicable diseases by more than 50%. Just lifestyle changes. So if you avoid smoking, you are be getting protected against cardiovascular diseases, type 2 diabetes, cancer, dental diseases, fractures, cataract. So all these are can be prevented by just avoiding of smoking. Similarly, if you do physical activity may be exercise, it may be daily walking or whatever. So if you pursue physical activity, you will be protected against cardiovascular disease, type 2, cancer, fractures, all these things. Similar is diet, consuming healthy types of fats, eating plenty of fruits and vegetables. Here, this audience is almost entirely of doctors. Can please raise your hands? How many of you eat fruits daily? Daily. Please raise your hands. I'm just able to see one hand. Two. So even though we are doctors, we know very well eating fruits will help us protect against so many diseases. But we take multivitamin tablets. How many of you take multivitamin tablets? Okay, maybe not here, but in other gatherings I have got a number of people. Definitely, Zincovit, Biplex Gold, whatever. They just keep on taking that tablets. So one of my very senior professors, he had told to a patient, ये मट्ठी क्यों खा रहे हैं आप? ये मट्ठी है. ये आप खाएंगे. Fruits, vegetables, if you are going to prescribe, no one is going to eat. But you prefer tablets. Patients also will come and ask you, ताकत का इंजेक्शन लिख के दीजिए, एक ताकत की गोली लिख के दीजिए. They never ask you what healthy foods they should consume. So why patients find it difficult to follow the lifestyle changes what we tell them? We tell them follow your normal diet, healthy diet, exercise daily. So why they find it difficult? Lack of knowledge. ऐसे ही बोलते रहते डॉक्टर साहब, कभी भी जगह तो बोलते हैं क्या फ्रूट्स खाओ बोलते हैं, जरा वॉकिंग करो बोलते हैं, घुटनों में दर्द है कैसा वॉकिंग करेंगे? That is the common notion. So they don't know the benefits of exercising daily. And when they come to you, mostly they'll come in complicated stage. They will not be coming in the initial stage. So lack of knowledge is one of the major factors, especially in the elderly. They don't take your views very easily. Rigid हो जाती है, एक बार सोच बहुत rigid हो जाती है जैसा एज बढ़ते जाती है, तो they won't take your opinion, they don't take your inputs. Half-baked knowledge. Nowadays, everything. You are getting blood in urine. Immediately Google मार के देख लेते हैं क्या आया? Okay, this they'll go to the highest possible diagnosis. So this is all half-baked knowledge, just based on Google. Nowadays, many doctors are facing this difficulty. When you sit in the OP, patients will come to you with already a preformed diagnosis in their head. That is based on Google. It is not based on any of their knowledge. गूगल बताया पहला ट्यूमर हो गया, पहला कैंसर हो गया, वॉट एवर दे हैव इट फिक्स्ड इन देयर माइंड, दैट इज करेक्ट. डॉक्टर इज नॉट करेक्ट. दैट इज व्हाट इज कॉजिंग मोर प्रॉब्लम्स इन द मैनेजमेंट ऑफ पेशेंट्स. लैक ऑफ मोटिवेशन. एनी lifestyle change, if it has to be done properly, the patient has to be motivated, number one thing. If he is not motivated, the doctor cannot do anything. अभी आप एक पेशेंट को बोल रहे हैं आप डेली एक्सरसाइज करना, आधा घंटा वॉकिंग करना, पेशेंट इटसेल्फ इज नॉट मोटिवेटेड. आज बारिश हो रही, नहीं होता जाना, कल दावत थी, कल दावत में देर से आए, नहीं होता जाना. सो दीज आर द, if they are motivated, yes, definitely they will go ahead with their routine activities. So how can we advise them? We can definitely tell them, no, आप नमाज को जा रहे हैं 5 टाइम, पैदल जाइए, आप एक्टिवा पे क्यों जा रहे हैं आप? So that will definitely take care of their physical activity. So the way we advise also is important, and the motivation of the patient is also important. Careless attitude. That is very hallmark of Hyderabadi population. चलता है attitude. क्या होता? कुछ भी नहीं होता. Even once they land up in complications, also they tend to ignore what disease they have. Especially this problem is among diabetic patients. आज एक दिन मीठा खा लिया, कुछ नहीं होता, अच्छा था मीठा, खा लिया, कल कंट्रोल कर लेंगे, वो कल कभी नहीं आता. So that is the problem among most diabetic patients. And when they go to the doctor for a review or a checkup, one day before they won't eat properly. They won't eat, so that their fasting blood sugar comes normal, and the doctor says, okay, your blood sugar is under control. Immediately when you do a HbA1c 9, 10, that is the common value. And here we have one more problem in the population here. What they tell, they proudly tell, 400 है शुगर फिर भी कुछ नहीं हो रहा मेरा, 500 है शुगर फिर भी कुछ भी नहीं प्रॉब्लम है, अच्छा हूँ देखो मैं. That is what is the problem. Careless attitude of the people. That can be changed only by changing their mentality or the behavior. Lack of social or peer support, especially for smoking and even for diet. When a person wants to change also, his family and his friend circle should support him. Otherwise, he will try to change, but they will again reinforce that bad habits in him. So lack of social support is a very important retarding factor for lifestyle changes. Easy access to ready-to-eat food. When we were small, if anything our mother prepares, only then we used to have in the house snacks or whatever we used to have. Nowhere we used to get ready to eat immediately on phone you are ordering, immediately whatever the child wishes, nothing like that. So ready to eat, easy accessibility. सबको मिल रहा, just phone पे order कर लो, it is coming. So that is also causing number of problems. More time on TV and smartphones. So all these factors are hampering the adoption of lifestyle changes in the patients. दावत में चले गए पूरा, just start eating whatever. People forget that they are human beings. खाली 10 बज गए, 10:30 बज गए, पूरे जाके वहाँ पे सिग्नल लगा वलीमे के पास, डोर के पास ठहर जाते, जहाँ पे खाना स्टार्ट हो रहा। दे डोंट इवन सी। That is a very common trend, and that is, I think, experienced by everyone. Whenever you go to a function, it is late. People just tend to crowd around wherever the food is there, and they eat as if they are not going to eat tomorrow again. That is what has become a common trend in our city only. That is a very speciality it has become. Sorry to say that, but that is a become a part of culture of Hyderabad, especially among our community. I'll want to quote one hadith here. I can read. The human who does not fill any container that is worse than his stomach, it is sufficient for the son of Adam to eat what will support his back. If this is not possible, one third for the food, a third for the drink, and the third for the breath. So this is a hadith. You should never fill till here. Eat little food, little water, and that is sufficient for your to keep you fit. Never eat. Overeating is never advisable in Islam, but people tend to overeat here, and that is the root cause of obesity. That is the root cause of diabetes. All these factors promote and contribute. So, what are the challenges for we as doctors? What are problems we face? Limited time. The OP will be there, 15-20 patients will be waiting. You cannot spend 20 minutes or more than 5 minutes for each patient. You will be time constraints. Even if you want to do it also, still because of the load or volume of patients, you cannot spend much time. You cannot give them detailed counseling on what to do. Let's focus on counseling. Most of the physicians, what they do, they tend to just write the treatment, take the treatment. That is what is the main focus of majority of the consultants. Less emphasis on preventive aspects. They will write the treatment. Even the patients will be more focused on क्या गोली लिखे आप, क्या insulin लिखे या whatever. And what at the max what you will tell, lose weight. You are not going to explain them or give them counseling on how to lose weight because we expect that the patient knows that. Patient expects the doctor is going to tell him. Unable to explain according to patient's needs. Some patients are very pestering. They tend to keep asking you a lot of questions. आम का सीजन है सर, आम खा सकते हैं? आप बोलते हैं हाँ खा सकते हैं, कितने खाना दें? You will not have that patience or the time to entertain all the queries. Then they tend to like, we eat, nothing will happen. What happens? थोड़ा sugar बढ़ती, कुछ नहीं होता उससे. बाद में एक extra गोली खा लेंगे. That is also a thing. They will tend to eat like we will manage accordingly. But this will have long-term effects on the body. This will cause long-term problems for the patient. So what we advise usually, our advice will be short to the point. So we will try to advise eat a healthy diet, maintain a healthy weight, be active, don't smoke or use tobacco or limit alcohol use. This is what will be the most broad terms where we will give them the counseling. We cannot give them a detailed counseling in each one of them. But the main problem lies here. Why? Because we tend to give them short advice. With just a short advice, patient is not going to follow that. They want a more detailed. So how to overcome this problem or challenge? There is something called as a concept of behavior change communication. This is what is required here. But what is this concept? I will try to tell you. They have to change their behavior. And behavior is learned through so many years. Since childhood, you are learning a thing. It will not be changed overnight. You cannot change your behavior overnight. Slow process, sustained process. It is due to support of the people around you. So how people initially will be unaware. What is the problem? They don't know what is the problem. Then you make them informed or make them aware. आपको शुगर है, शुगर किस चीज़ से बढ़ रही है आपको, what are the problems, why it is increasing, that is the knowledge part. Then they know that okay, due to this problem, due to increase eating more food or more of carb-rich foods or more GI glycemic index foods, whatever. So then their knowledge will increase. Then they should be concerned. That is, they should be taught about the complications. आज है नॉर्मल है कल बढ़ सकती है आपकी किडनी फेल हो सकती है आपको हार्ट अटैक आ सकता है whatever you have to scare them or you have to show them the reality that this will once you get a lifestyle disorder it will not be cured completely it will be like पिक्चर अभी बाकी है आपका बाद में आपकी आपका डेस्टिनेशन आपकी खबर है that is what and that is or you have to educate them about the complications. Only then he will see to that he'll change his behavior. So you will train them on the various skills to overcome his lifestyle problems and motivate them to change. Motivation is most important. Weight loss. You have seen one classic case, Mukesh Ambani ka beta. He was more than 200 kgs, he lost more than 100 kgs, he came back to normal because of motivation. But again, he became back to again obese. Okay, that may be due to steroid use or whatever they are telling, but it has to be sustained only when you are motivated. आपको weight कम करेगा वो maintain करना पड़ेगा. It is not like you have lost your weight, your goal is accomplished. It is not like that. Then maintenance and adoption of new behavior. So once you change that behavior, now daily you are going to namaz. Masjid is just maybe 200 or 300 meters from your house. So you go on your bike. So you will see that daily you go and come back. But once you start going by walk, one day you go for one namaz, second day you go for two namaz, carry that for 3-4 days, then you start going for the third namaz also by walk. So once in a month or so, you will get used to it. You will not feel any problem in that. But that physical activity got incorporated as a part of your life. So you will carry it daily. You cannot change that. So once you adopt that behavior, previously you used to go on cycles. So at least that was physical activity. But bike or cars, that is hampering your physical activity. So to prevent that, you should start slowly, sustain that and increase it further. So another, there is a lifestyle change model here that is called as assess, advise, agree, assist and arrange. So what doctors will commonly do is, first step is assess. They will assess what the patient's problem are. Okay, this problem, this patient is having diabetes, he is having like obesity, whatever, you are assessing him, you'll see the BMI, you'll see the blood sugars or whatever, advise him. See, you will get complications, so you should go for lifestyle modifications, reduction in weight, control your blood sugars, you will advise him. There ends the role of the doctor presently. You will see him, assess him, advise him, leave him. You are not going to see whether he is really doing it or not, and you are not going to provide any means for him to achieve his goals. So for that, there are something called as smart objectives or smart goals. That whatever goal you are making, it should be specific, measurable, achievable, realistic, and time. We'll see this. What is it? Specific. What exactly do you want to achieve? How will you know you will meet your goal? That it should be measurable. What steps are you going to achieve your goal? Relevant. Is it goal important to you? And what time duration will you take? Example. I want to lose weight. I want to lose weight. How you are going to lose? What you are going to do for that? No one knows. So this will not such New Year resolutions रहता ना एक दिन का आप बोलते अगले दिन भूल जाते. So that is what. So the goal should be a smart goal, specific, measurable, attainable, relevant, and time limits. I will go for a walk 5 times a week for 2 months. Achievable. उतनी देर आप walking करेंगे. Slowly you should start. So your goals should be smart goals to achieve this lifestyle changes. And most important part of any lifestyle modification is social support. Support from your family, support from your friends. डेली एक फ्रेंड है उसके साथ जिम को जा रहे हैं, उन्हें आया तो ही जाते हैं, उन्हें नहीं आया तो नहीं जाते. So that social support is there. So with that peer support you will go on and carry on your activities. Okay. Then way forward, we as DARE members or doctors, what can we do further? So these lifestyle changes needs to be incorporated right from childhood. Not like once the patient has already developed complications and come to you with CKD for dialysis, not like that, or have already had an MI, then what is the use? Instead of that, from childhood, if we start developing the healthy lifestyle by increasing physical activity and improving the diet, these are the two most important things which will reduce half of the diseases. Healthy lifestyle is good diet and physical activity. So this can be done at school level by creating more education programs at the school levels to educate the kids, carry out awareness program in masjids, because many people after namaz they tend to sit there. So there we can educate them that these are the problems you are facing solely because of your lifestyle. Once you change your lifestyle, half of your problems, diseases will definitely come down. And even health education videos. Doctors don't have time to counsel the patients, but we can create a set of videos that can be forwarded to each patient so that they will at least look at those videos and try to take up the details of how to change his lifestyle. आप बोल देंगे lose weight, that is not possible. How to lose weight? You can just show them what are the foods he should consume, what are the foods he should avoid, how much exercise is required, all those things if you put up in videos, educational videos. So once a patient comes to you, no need to give him the full counseling, just give him this link for those set of videos. They will see it their free time, and if they follow, it is for their own good. So you can contribute in that way also. So educating the people is most important to stop the lifestyle diseases, and by primary prevention, that is before the onset of proper set of disease only, we can stop all these diseases. Thank you. Any questions, please? Yep.
This BCC that you told us about, sir.
Yes.
So, are there any methodologies to implement this behavioral changes among the patients?
Yes.
So, and which, in your experience, is the most effective way to get results?
yes, behavior change is very important for non-communicable diseases. अगर आप उनको, you can show them like what happened to a patient who did not follow. Once they see, or once in their immediate relatives or something, this due to this behavior, this problem has erupted. So once they try to connect that with their own thing, then they will, and it is not a one-time process. It requires a sustained, constant effort. So maybe the immediate relatives of the patients, you can take them into confidence and advise them on how to go. There are a few methods how to carry out that BCC, behavior change, how to change their behavior. Like smoking, when you tell them to stop, if you just tell them, they will not stop. But even those marks like cancer, it causes cancer, all that is utter waste. But if they have really see a patient suffering from cancer or the suffering of the patient, then that change will try to come in them, and then you have to carry it out in a slow and sustained way. Follow them up, feedback of the surrounding people, of the patients, attenders, all that is very important in carrying out that behavior change.